Hey everybody, it's David Sirota. So last week I told you about how California lawmakers are considering state legislation to create a Medicare for all single-payer healthcare system. Well, at the same time that legislative debate was gearing up in the state legislature in California, California's U.S. Senator Dianne Feinstein, the Democrat, was holding a town meeting in which she was asked a lot about healthcare policy. And Feinstein declared in that town hall meeting her opposition to single-payer health care, to Bernie Sanders' bill that he has been pushing to create basically a Medicare for all system. What wasn't reported back then and what is now being reported today is that Feinstein made those comments just a week before she was scheduled to hold a big fundraiser for her re-election campaign with a lobbying firm that represents the healthcare industry. The lobbying firm represents health insurers, pharmaceutical companies, and the like. So she was making those comments in opposition to a Medicare for all system, knowing that a fundraiser with a lobbying firm that represents the healthcare industry was on her schedule. This is a really good microcosm of how much money is swirling around the healthcare debate. You've got in this situation a senator who is saying they don't want to support a Medicare for all system that the healthcare industry opposes, while that senator knows that a fundraiser with the healthcare industry and its lobbying firm is on her schedule. This is really shows, again, a microcosm of how there is always money hanging around the big debates about lucrative industries like healthcare that Congress is facing and dealing with. I mean, Feinstein got booed at the meeting about this, and I think that her office did not respond to questions about her raising money essentially from a lobbying firm that represents the healthcare industry while she is making public statements about healthcare policy in America. And I think that more and more of these questions are going to be asked of lawmakers as the healthcare debate heats up. You've got Bernie Sanders pushing a single-payer bill. He's one of the most popular politicians in America. Democrats are continuing to raise money from the health industry. I mean, Feinstein in her campaign, already her re-election campaign, she's raised money from donors who are connected to Blue Cross Blue Shield, the pharmaceutical industry. Now she's held a fundraiser with a lobbying firm that represents many of the clients in that industry. More and more people are going to be asking, who do you actually serve? Who are you answering to? Who are you voting for when you're dealing with legislation that challenges, in this case, the health industry? Feinstein's going to have to answer at some point those questions. I'm guessing that the story that came out, which you can find at International Business Times this morning, that story, I'm guessing, is going to, if not shock a lot of people, then certainly wake a lot of people up to the fact that in California, as that state deals with a single-payer debate in its state legislature, its U.S. senator is accepting money from an industry with a vested interest in blocking a single-payer system.